Dr. Ken Stewart, Assistant Professor of Primary Care at KCU Joplin, is here with us once again this month.
And he's going to detail the risk factors, warning signs, and preventive strategies for Alzheimer's disease, which is the most common form of dementia.
It is, and it's timely because June is Alzheimer's and Mental Health Awareness Month, so it's an important topic for us to talk about. We're talking about 7 million Americans that are affected by this disease over the age of 65, and like you pointed out, it is the most common cause of dementia. So we need to really kind of be aware of, just as with any type of illness, the earlier we can detect it, the more of an impact we can have and hopefully kind of stave off the progression of it.
We were all talking about this in the green room, and we're not sure if when we come into a room and we forget what we were doing there, if that classifies as the beginning stages of dementia, or if we need to watch for other types of warning signs. What should we be looking out for?
You're absolutely right. As we age, we kind of lose that ability to recall certain things. But when we start seeing that we have to make little notes for ourselves, or the things that we're used to doing, like making a certain recipe or driving to a certain location, we'll start noticing it's more difficult for us to be able to kind of be aware of those kinds of things. We forget dates more frequently. It's not just going into the pantry and going, what did I come in here for? It's more serious than that. It can actually get to the point where you can't even remember. You might get lost, not even know what the time or the date is.
Do you have a good suggestion if you begin to notice some of those a little bit more frightening signs and symptoms that you're mentioning? If we notice those in a loved one, what can we do?
Yeah, the important thing is to get it evaluated early. Your primary care provider has the ability to be able to test you. They've got mental testing and things that can actually detect early presentation of dementia, and certainly Alzheimer's dementia. You're also at risk of developing Alzheimer's if it's a family, if you have somebody in your family who's had it, or you know, you have other comorbidities like diabetes, high blood pressure, heart disease. Those kinds of things can also lead. Interestingly, when I was reading for this presentation, they were saying that people who are hard of hearing actually are more susceptible to developing Alzheimer's disease. So if you start losing your hearing, it's really important. Go get that hearing checked. Make sure that that's not a component that's a precursor to developing Alzheimer's.
I'd never heard that.
Yeah, isn't that something?
So if you're losing your hearing, you're forgetting things, you know, more serious, like a full recipe or something like that, go ahead and go to your primary care and look into that. Don't just ignore it. There's
some cognitive testing that can be done to be able to identify areas that might be indicating you might be developing some Alzheimer's dementia.
These are interesting factors and things that we all need to pay attention to. I find a lot of people, and myself included, we don't want to think about that.
Oh yeah.
But if you get in early enough, are there things they can do to help where it won't progress as fast?
You know, I think just they talk about exercising. Of course, exercise, they want to talk about 160 minutes of exercise, moderate exercise every week. So it's not like having to go to the gym 5 days a week and really doing a lot of real hard effort. It's really just moderate activity, so even walking, things like that. A diet, Mediterranean diet, healthy diets that use green leafy vegetables, nuts, olive oils to be used. Good time.
There's so much truth in that. She's taught me all about all the health benefits that they have.
And then, of course, alcohol, smoking, things like that that are not good for your health, watching your diabetes, watching your blood pressure, all those things that we always talk about on this Living Well segment about how to have a good quality of life. And that's really what we're all looking for. Quality of life is really what we want. Not necessarily longevity, but if we're going to live a long time, we want it to be quality.
We always appreciate you coming on to share with us each month, because you really help us think, and I hope people, when they watch you, they don't just disregard it, they listen and then they do something about it. If they have a loved one in their family, maybe go get that checked out, or just start an exercise regimen, because that's good for all of us. And you're reminding us of that.
Well, I get people that pull me aside and they say, hey, I saw you on Living Well, and can you tell me a little bit more about this? So we're getting really good coverage, and it's really amazing to have the opportunity to be able to reach out to our communities and inform them about things, about having a good quality of life.
Well, we appreciate you coming on here every month. Everybody from KCU, Haley, and all the doctors, the staff, you all are just wonderful, and you're just such an asset to the show and help our viewers, and we appreciate that so much.
Well, thank you. We love it and appreciate it.
Yes, and if you haven't seen seen the KCU school. We were all talking about that. You've got to see a tour of this place. It will amaze you that is right here in Joplin. It is beautiful.
It is beautiful, absolutely.
Yes, well, thank you for being here.
Thank
once
you.
again today.
Thank
we
you.
appreciate it. And ahead on Living Well.